My name is Matt Coons. I live at 17305 Madison Avenue. And I would like to speak briefly about what life is like with the Cleveland Clinic and changing health care. Most of my news comes from the Nordonia Hills News Leader. Early last November, communities in northern Summit County learned that the Sagamore Hills Medical Center emergency room would be shut down entirely at the beginning of December. The Cleveland Clinic, which owns and operates the center, had determined that patient volume is too low and the majority of patient conditions are not severe enough to justify keeping the Sagamore Hills emergency room open. Senior Director of Corporate Communications, Heather Phillips, told the News Leader that the site will be repurposed as an express care facility where people will be treated for non-critical conditions. In a follow-up press release, the president of the affiliated South Point Hospital said the express care facility makes it possible for South Point to continue to care for the community. This new level of care, he explained, will better serve residents and focus more on primary care services, which is what the community is utilizing. Right now, this new level of care does not serve residents under the age of 14 at all, however. Dr. Tarek El-Sawi of the Cleveland Clinic explained to concerned residents the staff will be undergoing special certification training that will qualify them to treat younger children. The training, he told the News Leader, should be complete by the end of the first quarter. Strangely enough, the relevant local officials did not sound happy about an exciting transformation in healthcare about which they received less than 1 month's notice. Quoting from the News Leader, Northfield Center trustee Paul Boucher said the change is sudden and leaves the fire department with an urgent need to expand staffing due to longer transport times. It's leaving us high and dry, and it all comes down to money, Boucher said. It's going to cost us $109,000 off the bat just for personnel. As context for Mr. Boucher's remark, we might consider the response of a clinic representative when asked if anyone actually visited the facility prior to closing the emergency room. Dr. Brad Borden told reporters that no dedicated road trip was made, adding the decision was made based primarily on numbers. It appears the decision was not made based on any consultation with local emergency response workers. Northfield Center Sagamore Hills Fire Chief Frank Risco has had a number of comments throughout the struggle to respond, which has continued even into recent weeks. In the News Leader, Risco said significant travel time will be added when transporting patients. This adds a minimum of a half an hour driving time to each call at least, he said. Adding the response time would be extended further in the event of inclement weather or road
Mr.
construction.
Booth, I'm sorry, please wrap up your comments. You're up against the time.
I have read this speech 5 times today, and I have never gone near 5 minutes. Adding that time to travel means that squad is out of service in effect. In November, Sagamore Hills trustee John Zaccardelli asked Dr. Borden if there was any way to extend the December 1 cutoff to January 1 to allow time for the district to staff properly. Borden said no. Of the timeline, which the Cleveland Clinic had announced almost a dozen whole days before, he said, that's set in stone. And if you want to cut me off there, be my guest.
Thank you. We do have a 5-minute.